That little tin of baking soda sitting in your cupboard, the one that cost you $2, it can do more for your mouth than half of what's lined up in the dental aisle at the store right now, and it's sat there quietly the whole time without anybody thinking to mention it. We have done this for generations. My grandfather never once drove into town for a fancy tube of whitening paste or a bottle of mouthwash with a name he couldn't pronounce. He reached for what was in the kitchen, and he handed that knowing down to my mother, and my mother handed it down to me. Plain and simple, the way you pass a good tool across a fence. Here is the part that sits wrong with me. The folks who sell you those bright plastic tubes and bottles, they have no reason to tell you any of this. None at all. A man does not advertise the thing that empties his cash register, so they let it stay quiet. They let you believe you need the special paste, the special rinse, the special pick with the fancy handle, and you have been paying for it for years. I want to fix that today. Before I go further, do me one small kindness. Tell me down in the comments what you struggle with most: sensitive teeth, bad breath, or just keeping things clean between visits to the dentist. Just a word or two. I read them and it helps me know who I'm talking to. Now stay with me, because partway through this, I'm going to show you the one trick for a sudden toothache in the middle of the night, when the nearest dentist is a long buggy ride away and morning feels like a year off. The exact way it was handled on the farm where I grew up, where help wasn't always close, and you learned to lean on what was already in the house. There are 7 ways in all. Let me give them to you the way they were given to me. Let's start with the one everybody's curious about: keeping your teeth clean without a store-bought toothbrush at all. Number 1, the chew stick. Long before anyone had a plastic brush with nylon bristles, folks used a small green twig, usually from a tree with a bit of natural bite to it, walnut, or a young willow branch. You'd snap off a fresh piece about the length of your finger, chew on the end until it's softened and frayed into something close to bristles, and use that frayed end to work along your teeth and gums. Here's why it isn't just an old habit for the sake of habit. The wood itself carries natural compounds that discourage the growth of bacteria in your mouth, and the physical fraying of the fibres cleans between teeth in a way that's surprisingly close to what a bristle brush does. Dentists today, when they've studied this properly, have actually found the wood from certain trees carries antibacterial properties that hold their own against plain nylon bristles. My grandfather didn't have a study from a university. He had his teeth, all of them, well into his 80s, and 80 years of watching what worked. It pleases me to no end that the scientists finally walked out to the same spot we'd been standing on the whole time. Now, I'll be honest with you the way a neighbour should. A chew stick isn't meant to replace a proper toothbrush entirely in a world where you have one sitting right there in the bathroom, and I'm not telling you to throw yours out. It's meant to show you that cleaning your teeth was never as complicated or as expensive as the aisle at the store wants you to believe. A fresh twig cost nothing but a walk to the fence line, and a household that couldn't spare the coin for a store-bought brush was never a household with poor teeth for it. But teeth are only the beginning, because if a simple twig can do that much, you might be wondering what else was sitting quietly in plain sight the whole time. And the next one surprised even me when I was young. Number 2, oil pulling. This one sounds strange the first time you hear it, and I understand if it sounds stranger still the first time you try it. You take a spoonful of plain oil, sesame oil or sunflower oil were what we had on hand, and you swish it around your mouth for a good while, 10 minutes if you can manage it, pulling it back and forth between your teeth before spitting it out into a rag or the trash rather than the sink, since it can build up in your pipes over time the same way grease from a pan does. The oil works its way into all the little places a rinse of water never reaches, pulling loose debris and bacteria along with it. You spit the oil out when you're done, you never swallow it, and you follow it with a plain rinse of water and your regular brushing right after. This isn't a modern invention dressed up to look old. It's an old practice that modern researchers have gone back and actually looked at. And while it isn't a miracle on its own, several studies have found regular oil pulling can meaningfully reduce the bacteria responsible for plaque and bad breath, working alongside your regular brushing rather than in place of it. My mother did this most mornings before breakfast, plain as making coffee, and she never once thought of it as anything special. It was just what you did. 10 quiet minutes with a spoonful of oil while the kettle came to a boil for the day ahead. Number 3, a homemade tooth powder. Before there was ever a tube of paste with a dozen ingredients you can't say out loud, there was a simple jar on the shelf. Take plain baking soda, add a small pinch of fine salt, and if you had it, a bit of ground dried sage or a touch of cinnamon for the taste, and for what it does for the gums. Mix it together and keep it in a small jar by the sink. You dip a damp brush into it and use it just like you would any paste. The baking soda is mildly alkaline, which makes it harder for the acid-loving bacteria in your mouth to thrive, and it gently lifts surface stains without the harsh chemicals in a lot of what's sold today. The salt adds a bit of its own antiseptic quality, and sage has long been used for its calming effect on irritated gums. Some households added a touch of ground-dried mint from the garden as well, mostly for the taste, since a jar that smells and tastes pleasant is a jar folks actually reach for morning after morning, and a good habit only lasts as long as you're willing to keep it up. Here's the catch, and I'll give it to you plain because I always give you the catch. This is not something to use every single day without a break. Baking soda, used too often, too aggressively, can be harder on your enamel over time than a gentler paste would be. 2 or 3 times a week, worked in gently, never scrubbed hard. That's the old way. And the old way was almost always the patient way. That's exactly why it lasted. Number 4, clove for the toothache that catches you at the worst possible hour. This is the one I promised you, the trick for the middle of the night when a dentist is nowhere close and morning feels far away. Whole cloves, or a small drop of clove oil if you had it in the cupboard, carry a compound that has a genuine numbing effect on sore, aching tissue. You take a whole clove, or a cotton ball, with the smallest drop of the oil on it, and hold it gently against the aching tooth or the tender gum beside it. Within a little while, the ache would dull enough to let a body get some sleep. This wasn't a cure. Nobody on that farm ever mistook it for one. A toothache that keeps coming back, that won't let up. That's a sign something underneath needs a dentist's proper attention, and no amount of clove was ever meant to replace that. But for getting through's a rough night until you could actually get to help, it did its work quietly, and it did it well, and it still does today. A little goes a long way here, so use the smallest amount and never soak the tissue in it, since too much can irritate the very gum you're trying to soothe. Number 5, a warm salt water rinse for the gums. This one is about as plain and as old as anything on this list, and it's stuck around this long because it genuinely works. A spoonful of salt stirred into a cup of warm water, swished gently around the mouth for half a minute or so, spit out, not swallowed. Salt draws down inflammation in tender, irritated gum tissue, and it creates an environment that's a good deal less friendly to the bacteria that cause the redness and swelling in the first place. My grandmother reached for this more than anything else on this whole list, after a meal that didn't sit right, after a tooth came in wrong for one of the children, after a long day of dust and work in the fields. It cost nothing beyond what was already sitting in the kitchen, and it asked for nothing more than a little warm water and a minute of your time, which is more than most things on a store shelf can honestly claim. Number 6, crunchy raw food as nature's own toothbrush. An apple eaten whole, a raw carrot, a stick of celery. The chewing itself does real work, scrubbing along the surface of the teeth and stimulating the gums and the saliva that naturally rinses your mouth clean through the day. This isn't a replacement for actually brushing, and nobody who raised me ever pretended it was, but a diet built around real, whole, crunchy food, and away from the soft, sugary, processed things that cling to your teeth and feed the bacteria that cause decay in the first place. That diet alone does more for a mouth over a lifetime than any single product on a shelf ever could. My people ate what came off the land, plain and whole, and it wasn't a health fad to them, it was just supper. And their teeth, well into old age, told the story better than I ever could. Number 7, and I saved this one for last, because it's the one almost nobody outside these old ways remembers anymore. An herbal rinse for the gums using sage or chamomile. You'd steep a small handful of dried sage leaves, or chamomile if the sage wasn't handy, in hot water the same way you'd make a cup of tea, let it cool until it was just warm, and swish it gently around your mouth, holding it near any spot that felt tender or swollen. Both of these herbs carry a natural calming effect on inflamed tissue, the kind of gentle relief that doesn't come with a warning label a mile long. My grandmother kept a small tin of dried sage on the windowsill for exactly this, right alongside the tin she used for cooking, because to her there was no real line between the plant that flavoured supper and the plant that soothed a sore gum. It was all just what grew in the garden and what the garden was for. But here is where I want to slow down, because I know some of you watching are thinking, this is all fine for a young mouth with straight, sturdy teeth and nothing much wrong yet. What about the rest of you, the ones who've lived with the same set of teeth for 40, 50, 60 years? Crowns here, a filling there, gums that have pulled back a bit with age, a mouth that's seen a fair amount of living. I want to talk to you for a minute, because the old ways were built for exactly your situation too. My people didn't have young, perfect mouths waiting around for these methods to work on. They had mouths that had chewed through decades of hard bread, tough meat, and long winters, and these 7 ways were leaned on just as heavily, if not more, by the grandparents in the house as by the children. If you've got an older mouth with dental work already in it, a few of these deserve a gentler hand. The homemade tooth powder, for instance, is fine around natural enamel, but if you've got crowns or fillings along your front teeth, ask your dentist first, since not every material responds to a mild abrasive the same way plain enamel does. The chew stick and crunchy raw foods are wonderful for gums and for teeth that are still solid, but if you're missing teeth or have loose dental work, a whole raw carrot might be more than your mouth wants to take on, and there's no shame in cutting it into smaller pieces instead, or leaning more on the rinses and the oil pulling, which ask nothing of your bite at all. And if your gums have pulled back with age, exposing more of the tooth root than they once did, the saltwater rinse and the sage or chamomile rinse become even more useful, since that's exactly the kind of tender, exposed tissue those two were always meant to soothe. An older mouth isn't a mouth past helping, it's a mouth that's earned the right to be cared for a little more gently, and the old ways knew that just as well as they knew anything else. Now, I want to slow down here and be honest with you, the way a neighbour should, because I promised you both sides of every one of these, and I meant it. None of what I've just given you replaces a proper dentist, and I would be lying to you if I let you walk away thinking otherwise. These 7 ways were never meant to fix a genuine problem once it's already taken hold, a real cavity, a real infection, a tooth that's gone bad underneath where your eyes can't see. What they were meant to do, and what they still do well, is keep a mouth healthy in the years and the days between visits, at a fraction of the cost of what fills a store shelf, using things that were already sitting in the house. My people didn't avoid a dentist out of stubbornness when a real problem showed up. They avoided paying for what they didn't need, and they leaned on the old ways for everything in between. That's the whole difference, and it's worth remembering. Here's what I think gets missed in all of this, and it's worth saying plainly. There isn't some grand plot sitting in a boardroom somewhere to keep you sick so a company can profit. It's simpler and quieter than that. A jar of baking soda and a spoonful of salt don't need a marketing budget, and nobody's getting rich selling you something you already own. So the old ways just never got the advertising, not because they were being hidden from you on purpose, but because there was never any money in reminding you. The folks selling the tube with a dozen ingredients aren't your enemy, but they also have no reason to tell you that a plain jar from the cupboard can carry a good deal of that same work. That's simply how it's always gone, on the plain side of the fence and the other side both. Let me tell you what this looked like in practice, because I think it matters more than the list alone. Growing up, there wasn't a trip to town for a new toothbrush every few months, and there certainly wasn't a cabinet full of different rinses and whitening strips and floss picks in every flavour. There was a jar by the sink, a tin of salt in the cupboard, a few cloves kept on hand for exactly the kind of night I described earlier, and a garden with sage growing along the fence line where anybody could reach it. And when I think back on my grandparents' smiles, worn in from decades of hard work and plain living, what I remember isn't a mouthful of problems. It was teeth that had simply been cared for, steadily, cheaply, and without fuss for 80 years running. That's not a story I'm telling you to sell you anything. It's just the truth of how it was. Let me answer a few things I expect folks will ask, because these same questions come up every time this kind of knowing gets passed along. Is it safe to do more than one of these at the same time? Most of them sit fine alongside each other. The tooth powder in the morning, a salt water rinse after a meal that didn't sit right, oil pulling before breakfast on the days you remember, none of that crowds against the other. Where I'd tell you to go slow is layering the clove directly against tissue you've already worked over with the tooth powder that same hour, since both can be a bit much on already tender gums if you stack them without any space between. How long before you'd expect to notice any difference? My family never measured it in days the way folks want to today, but if I had to put a number on it, most people who keep at the saltwater rinse and the oil pulling regularly notice fresher breath and calmer gums within a week or two. The tooth powder's effect on surface stains tends to show itself a bit slower, closer to 3 or 4 weeks of steady, gentle use. None of it works overnight, and none of it was ever meant to. What if you try all 7 and something still doesn't feel right? Then you're looking at something these 7 ways were never built to handle, and that's exactly when you stop reaching for the cupboard and start reaching for the telephone to call a dentist. My grandmother knew the difference between a sore gum that wanted a little sage tea and a bad tooth that wanted a professional's hands, and that difference is worth knowing for yourself too. Do children benefit from these the same way? Some, yes, plenty of gentle. A salt water rinse and simply eating whole, crunchy food instead of soft, sugary snacks served a household full of children just as well as it served the grandparents. Clove and the tooth powder call for a bit more caution with little ones, and a proper toothbrush and a dentist's regular eye still belong in a child's routine the same as anybody's. So here's what I want you to carry away from today. You didn't lose anything by watching this. You got something back, something that was quietly set aside over years of being told you needed the special version of everything for every little job in your mouth. 7 old ways, most of them costing next to nothing, sitting in a kitchen you probably already have. That doesn't mean you throw out your toothbrush or skip your next cleaning. It means you stop thinking every bit of care for your own mouth has to come wrapped in plastic with a brand name on it. If you're still here with me, you're the kind of person who'd rather understand what actually works than pay for what simply shines on a shelf. My people never had much choice in that matter, living plain and close to the land the way they did, and it turned out to be the better way a good deal of the time. Go check that cupboard of yours. If the baking soda's running low, the next box will cost you a couple of dollars, and it'll outwork more of that dental aisle than you'd expect. And do this for me before you go. Head back down to the comments and tell me which of these 7 you're going to try first, the chew stick, the oil pulling, the tooth powder, or something else on the list. I asked you at the start, and I mean it, I read every one. If this is the kind of knowing you're after, the plain and practical kind that mostly went unwritten, stay close, because there's more of it where this came from, and I'd like to keep passing it along the way it was passed to me. One small, cheap, honest thing at a time, the way it always used to be done before there was a product for every single one of them. This video is for educational and informational purposes only. It reflects my own personal opinions and observations based on things I've come across on YouTube, Google, and various news sources, and it is not medical or dental advice of any kind. I am not a dentist, doctor, or any kind of licensed professional, and nothing in this video should be taken as a diagnosis, treatment plan, or a substitute for care from a qualified dental professional. Everyone's teeth, gums, and oral health history are different, and what has worked for one family or one household may not be appropriate or sufficient for another. Please continue seeing a licensed dentist for regular checkups and cleanings, and consult one directly before relying on any home practice for an ongoing dental concern, especially anything involving pain, swelling, or bleeding, since those can be signs of something that needs proper professional attention rather than a home remedy alone. Use your own judgment and treat everything shared here as a starting point for further reading and conversation with a qualified professional, not as a final word on its own.